Hi there, welcome to my channel. If you are familiar with being here and hanging out with me, then you're probably like, Tiana, what the heck is up with your hair? Let me just say that I am not holding myself personally responsible for anything that happens to my hair or my nails during quarantine because nothing is open. There's nothing I can do about it. So I've tried to spice things up and failed freaking miserably, as you can see. I don't even know what color this is supposed to be. But I am giving you permission for yourself to just not feel guilty about anything that you've tried to do in an attempt to make up for not going to the hair salon or getting your manicure, because we are all in this together. How many times have we heard that? We're all in this together. Now, on a more serious note, I want to talk to you guys about not quarantine, but this pandemic, how it's been. I have been away from YouTube, away from this channel, not really doing much, not saying much, not addressing COVID, and my husband said I should. So here I am doing that. I hope my knee bouncing in and out of the shot doesn't bother you. I'm kind of sitting relaxed in my office. And this is actually a view I don't think you've ever seen with my makeup shelf. But I thought it'd be an interesting angle for an interesting topic. So COVID-19 kind of took us all by surprise. And throughout this whole pandemic, I've just, for one, been so thankful to have a job, and a job that I love. I went into critical care because I knew I wanted to care for the sickest patients in my hospital. I wanted to use my critical thinking skills, and also I work at a community hospital in my area. So I also knew, choosing that hospital, that I wanted to care for my community members and small business owners, my mailman, teachers, my neighbors. And throughout all of this, it has been so humbling and such an honor to be able to be there to support the members of my community during this really scary, uncharted time. And I think it's all so fitting that it is Florence Nightingale, the founder of modern day nursing's 200th birthday this month, this May. I believe it was May 12th. I could be wrong, but I know it's this month. And on top of that, the World Health Organization has deemed 2020 the year of the nurse and the midwife. So we've got the pandemic, right? It's Florence Nightingale's 200th birthday, and it's the year of the nurse. And we, as nurses, are being called upon to step up. How great is that? I can't say enough how completely humbled and honored I am to be a nurse, to be an ICU nurse, and you guys to be caring for my community members. I feel so lucky. I really do. Now, let's get down to the good stuff, the stuff that you really want to hear about, right? So, do we wear masks for our entire shift? Yeah, we do. They're really just surgical masks that I wear from the time I walk into the building until the time that I walk out. And walking into the building, all the exits are locked. There are only 2 exits, but entrances that So staff consists of everyone from physicians to respiratory therapists, pharmacists, everyone. Everyone's funneled through these 2 doors, and it sounds like, oh, you're funneling through, you must be close together. We're not. We're very mindful about staying 6 feet apart, that social distancing, slowing the spread, right? We come in and there are cameras that sense our temperature, and then we are asked, are you having any of the symptoms, sore throat, cough, fevers? And we say yes or no. And then, because I work in a critical care area, I work in ICU where we intubate patients, we have patients on ventilators, we extubate patients. There's a lot of aerosolizing procedures done in my unit. And so we have hospital issued scrubs. So we sign them out at the beginning of the day, and then at the end of the day, we turn them in and we sign them back in. They're sterilized and washed, and starts all over. But we're wearing our surgical masks all day. So gosh, I get to work probably at 6:48 in the morning, and I probably leave at 8:15 at night. So that whole day I'm wearing a surgical mask unless I'm working with a COVID positive or suspected COVID patient. We have patients who are treated just like they have COVID, and they're either suspected because maybe they tested negative on the COVID test, but they have the signs and symptoms. So we assume that maybe their viral load just isn't enough for the test to sense. So the sensitivity just isn't there for their viral load at the time of testing. Or, I don't know, there's lots of different circumstances. But my point being that when we're treating those patients, we take off our surgical mask. And if you have an N95, you wear an N95. And what I mean by that is we do fit testing annually. So once a year, every employee goes to the employee health office. They're specially trained nurses, and they test you to make sure that your mask, your PPE, fit appropriately and safely. And there's a whole long thing with that. If you're curious about how we do fit testing, I'll absolutely tell you. Just let me know. Leave a comment down in the comment section down below. But I failed the fit testing. I don't know if I just have a funny shaped face. Maybe it's these cheeks. I don't know. But the N95 respirator masks don't fit me. So I have to wear a PAPR mask instead. I do have a picture of myself in it, and I'll link it somewhere. Maybe I'll post a little picture. If I can figure out how other YouTubers post cute little pictures like up in the corner, then I will do that. If not, I'll just kind of slide it in somehow. It's not very attractive, but keeps me safe. So after we care for those patients, we switch our masks out. So I take off my respirator, not my respirator, it's called a PAPR. I take off my PAPR mask and I put my surgical mask back on. And then I wear it all day. And it keeps us from, let's say I'm infected and I don't have any signs or symptoms yet. Well, if I'm charting in the station with all the nurses and doctors, and we're talking about our patient care all the time. And so I don't want to be spreading it to them. So a surgical mask doesn't protect you or me from getting COVID-19. It just prevents me from spreading it. So that's how we're controlling it in the hospital. Now, have my coworkers tested positive for COVID? Yeah, 2 in my unit so far. One was a night shift nurse, the other is a day shift tech. Does that make me feel like I'm more susceptible for getting it? No. I've worked with a lot of COVID positive patients, and I've heard rumors out there, rumblings out there that families are scared. They're terrified that nurses aren't going into rooms and caring for patients adequately because they are in isolation. Well, yes and no. We're bundling care. So we're not going into the room every 5 minutes. But when I'm in a patient's room with COVID or not, I'm in there for a good hour because there's so much that we have to do. So if you have a loved one who's in the ICU, who's COVID positive, please don't fear that your nurses are giving less care, because we're not. We really aren't. We're giving more care to these extremely sick patients. Yes, we're bundling care, but we're in there for a long time. And so my point being that I'm in these, or I have been exposed to COVID positive patients for hours at a time with aerosolizing COVID in the air, aerosolized, I don't know, with COVID droplets in the air. And guys, I mean, gosh, what is it? It's May 20th today, and I've been caring for these patients since February. So I'm not scared that I'm going to get it through work because I'm taking all of the precautions. I'm washing my hands. I'm social distancing. To prevent my community members from getting it, because though I love that I work at a community hospital, I don't want to see my favorite Jewel Osco cashier in my hospital bed. I want to see him at Jawasco or, maybe on the sidewalk and wave hi. And so I don't go to stores. My husband shops for us. I'm trying my best to slow the spread. um, is it scary caring for these patients? Yes and no. I'm not scared of the disease. I'm scared because I work with the sickest patients, right, guys? So I've seen with these COVID patients that they can go from stable to crashing like that. That's what scares me. That I need to be on the top of my game every day, all day. And I need to catch the most minute changes in order to prevent poor outcomes for my patients, because I love nursing. I love what I do, and there's nothing better than helping a patient recover and get back to their baseline. That's what nursing is. We don't try for miracles, as in, if you at baseline lived in a nursing home, I'm not expecting to get you back home and walking and out in the community. We're trying to get you back to your highest level of functioning. That's what nurses do. And we do it in a caring, loving way because we love you. Another question that I've heard or had asked to me: do I feel like my leadership is supportive? I do. I have an amazing manager, and my day shift supervisor is also my mentor. So maybe I'm a little biased, but I think they're doing a fantastic job. The people at my hospital are about transparency and education, and knowledge is power. And so they are empowering us with knowledge and education, and our leaders above my own unit leaders, the hospital CNO, the chief nursing officer, the hospital president, other suits, I don't, for lack of better word, round all the time. And they ask us, do you have any concerns? Do you have any questions? Is there anything I can help you with? How are things going? And actually, I'm not going to say her name because I don't have her permission, but I ran into one of the leadership members. Not really ran into her, but I was grabbing a coffee because you got to have coffee on these long 13-hour shifts. And she bought my coffee, and I was like, oh my God, thank you so much. Such a small gesture, but it means so much. And while I'm talking about gestures, the outpouring of support and love from the community, from people we know, people we don't know, my own high school that I graduated from, they sent food for the night shift. I'm a day shifter, but as I was leaving, I saw a room full of food from, I'm not going to say the name, but the Tigers. It was just, it warms my heart. We get food for lunch, we get food for dinner. I've gotten Crocs from Crocs. And so all of this support and love for not just nurses, but everyone in healthcare, they call healthcare heroes, has just been amazing and really has made us feel supported and uplifted. And on those days where we've been scared, because guys, when we first heard that they're going to hand us a surgical mask to wear at the beginning of the week, and that's the only one surgical mask that we get for the entire week, we we didn't have such nice opinions about it. And now I feel like maybe we're like beaten dogs who just kind of accept that we've got one mask for the shift or for the week, which doesn't sound encouraging, but it's the times, and it's an effort to make sure we don't run out of PPE. And let's be honest, I work in the intensive care unit, and so sometimes I don't want to sound arrogant when I say this, but because we're exposed to aerosolizing procedures, we don't really listen to the one mask a week rule. We change our mask out as we feel we need to. And our managers and supervisor has supported that and said, you do what you need to do to feel safe, which gosh, just shows you how amazing my leadership is. And I'm sure that if the higher ups did find out, they'd be completely supportive because it's all about safety. And I really feel supported and cared about within my company. I don't feel like I'm just a staff nurse with an employee number. I feel like important as an individual, which is crucial in any organization because if you just feel like a cog in the wheel, I feel like you're less likely to go above and beyond and excel and be the best you can be. But when you are Tiana, ICU nurse, and everybody knows you, and even if you're not ICU nurse, if you're Katie, observe nurse, it doesn't matter. If you feel important and you feel special, I feel like you will strive to be the best. And my organization does a great job at that. And so, yes, COVID has been scary, but they're not all scary. And yes, we get face marks and scars, and we've been breaking out. And I usually have such great skin, but with this pandemic, I wear a surgical cap. Oh gosh, you guys, you know what I'm going to do? I'm going to do a video all about my favorite COVID PPE because I love the scrub cap that I have. I got it from Etsy. The shop is amazing. I'll go in depth in this other video that I post. Look for it because you won't want to miss my favorite PPE. So the surgical cap, and then we've got our surgical mask, and I wear glasses at work because I'm blind. And so there's really like this much skin showing throughout my 13-hour shift. So I've been breaking out, and that's been a struggle. Not that I'm in pain, it's just there are side effects. But people are staying home, and so there are much worse things. So when I put into perspective how my personal struggles are, at the end of the day, I love nursing. I chose critical care, and I love it. I love what I'm doing, and I feel so fulfilled. And it's the year of the nurse. It is Florence Nightingale's 200th birthday year. So I feel like I'm being called to duty, and it's an amazing thing, I think. Please, guys, I want to hear from you. I want to hear what you're doing. Are you working? I've heard that some student nurses have been, for lack of better words, forced to work in hospitals without pay as kind of a clinical. Some nursing students are doing clinicals online. I want to hear from you. Tell me, are you a nurse who's having a horrible time? Do you only get truly one set of PPE, one gown, one whatever that you have to use the whole week? And is your hospital strict about that? Or do you get to switch it out as you feel need? Let me know. I want to know all about everyone's experience with COVID. So leave it in the section below. Now, let's get to what we've all been waiting for, and that is the giveaway. I keep saying it because I'm super, super excited about it, but it is the year of the nurse, Florence Nightingale's 200th birthday, and gosh, I'm just so happy to be a part of this profession, and I want to welcome my new nurses into it by purchasing and gifting to you, giving away one UWorld NCLEX-RN 60-day access to a question bank. It's over 2,000 questions and one self-assessment. It is a value of $159 that I want to give away to one of you. Now, to enter, all you have to do is subscribe to my channel, like this video, and tell me why nursing. What is it that makes you want to go into nursing? For me, gosh, there's so many things that I loved about nursing prior to becoming a nurse, and now that I'm a nurse, I love it even more. But tell me about you. What is it about the nursing profession that drew you to it? What is it that made you want to be a nurse? Let me know in the comment section down below, and then I'll put more details about the giveaway in the info box. I love you guys. Till next time.